humans are influenced as much by motivational factors as by cognitions. And sometimes we think and feel and behave a particular way because they're overpowering motivations that make us want to think and feel that way. And while most of us, when we're suffering, we would like to get better, there's another side of us that clings to the status quo. Anthony de Mello, the Jesuit mystic, said we yearn for change but cling to the familiar. Mm-hmm. And what we've begun to do is to look very deeply into the reasons why people might not want to change and find a way of bringing that resistance to conscious awareness and then melt it away at the beginning of therapy before we use any techniques to get the person really on board wanting to play ball with us, to become a part of the team. The techniques are difficult to learn because they go against human nature, and therapists are always wanting to sell patients on change. We're trained to try to help people, to argue why they should change. And when you use these new techniques, you go the other way. You become the voice of the patient's subconscious resistance and show them all the reasons not to change, and then you do what we call sitting with open hands, where you're saying that maybe this isn't something we should work on. I can see a lot of reasons for you to maintain your depression or your alcoholism or your troubled marriage or your panic attacks or whatever it is. And when you do that skillfully, the moment you become the voice of the patient's resistance, the patient becomes the voice of change, and then you see fireworks. Then you get on board with the patient, and you can often see amazing high-speed changes.